Good afternoon and welcome to today's webinar, Long-Term Services and Supports, LTSS, Medicaid After the Public Health Emergency. My name is Tammi Cave. I am a Management Analyst and Caregiver Specialist with the Caregiver and Supportive Services Unit with Fairfax County Area Agency on Aging. Before I introduce today's speaker, I will go over a few housekeeping items. First, I would like you to know that closed captions have been enabled and today's presentation is being recorded. A link for the recording will be sent to all registrants a week from today. There is a Q&A button at the bottom of your screen where you can submit any questions you may have. We are going to allocate a few minutes at the end of the presentation to go over and address your questions. Last, there will be a brief survey as you sign out. Please take a moment to fill out that survey because it helps us to create programs that are relevant and important to our caregiver community. Now, it is my pleasure to introduce today's speaker, Joan Irwin. She is currently a long-term services and support intake supervisor for Fairfax County Department of Family Services. She is the supervisor for the Public Assistance and Employment Division, or PAES. She has been with the Long-Term Services Support Team, or LTSS team, for 25 years. Currently, she supervises the LTSS intake team that determines eligibility for Medicaid, the auxiliary grant, and the SNAP program, which is the Supplemental Nutrition Assistance Program. Joan, we thank you so much for being here today, and we're looking forward to your presentation. So please take it away.
Thank you, Tammi. I hope everybody can see my screen. Thank you for the introduction. I am, as Tammi said, the intake supervisor for long-term services and supports. If I call myself or say long-term care, I'm talking about the same programs because over the years they've changed the names. First, before I start this presentation, I just want to provide a little disclaimer. What is stated here today can change at any given time. So please just keep in mind that what we're telling you today may not be policy when it's time to do the renewal for the individual that you're working with. I want to give some background information to you all about the Virginia Medicaid program. First, it's a federal-state partnership that provides medical care to individuals that meet certain income requirements based on federal tax filing status. Some Medicaid programs also have a resource test for eligibility. That's where a bulk of our long-term services and supports individuals fall into.
Joan, we can't see your PowerPoint yet. I don't know if you started it.
Oh, I did. I'm sorry. Let me see. Yes.
There you are.
Sorry about that.
No, that's okay.
So I thought I had left it on there on the thing.
Yeah, yep, we see it perfectly. Great, thank you.
Okay. The Medicaid program is a federal-state partnership to provide medical care for individuals that meet certain income requirements based on their federal tax filing status. Some Medicaid programs also have a resource test for eligibility. If eligible for Medicaid, all recipient cases are redetermined on a yearly basis. Long-term services and supports recipients have an asset transfer policy on intake and at renewal. Additionally, these individuals also have a patient pay expense. There are two state organizations that are mentioned throughout this presentation. The first one is called the Department of Medical Assistance Services, DMAS. They're the overall state agency that administers the Virginia Medicaid program. Then we also have the Virginia Department of Social Services, which is involved in the automation of the Medicaid program. So you will see either DMAS or VDSS in this presentation. To get started, I just want to give you some basic overview of COVID public health emergency. Federal guidelines required that all states maintain clients' eligibility as of March 2020. Cases could only close for the following reasons: death, they move out of state, client request, or they went to jail. In addition, our long-term care services and supports recipients cannot have an increase to their patient pay during the public health emergency. So what this means is we have to, in order to know where we're going with Medicaid, we need to look at where we were with Medicaid. Prior to March of 2020, new Medicaid recipients had 30 days to start services or be placed in a nursing facility. Applicants and recipients with income over 300% income level that want in-home care had to meet monthly spenddowns of medical expenses. Ongoing recipients that stopped services would have Medicaid coverage reevaluated after 30 days. Recipients had annual Medicaid renewals, and recipients that reported changes for LTSS patient pay were completed within 30 days. However, starting March 2020, going through March of 2023, the public health emergency was in effect. And that meant that new Medicaid recipients did not have to start waiver services or be placed in a nursing facility within the 30 days. Applicants, recipients with income over 300% that wanted in-home care did not have to meet monthly medical spend-downs. Ongoing cases could not close unless one of the following conditions were met: that they moved out of state, they died, requested their case to be closed, or were in jail. Renewals were paused, and recipients that reported a long-term services and supports patient pay change, we could only reduce their patient pay. We could not increase it for any reasons during this time frame. We are now, as of April 2023, in what the state is calling the Medicaid unwinding, which means is that federal mandates require states to resume normal Medicaid procedures. Normal Medicaid procedures is what we were prior to March of 2020. So on that previous slide, it's that left-hand side of the screen. Renewals resumed with a new state schedule. Long-term services and supports Medicaid recipients with excess resources may have extra time to reduce resources to remain eligible for Medicaid. Asset transfers may affect individuals that have sold, given away, or traded resources for less than the fair market value in the pandemic. You may be wondering how to prepare now for the Medicaid renewal. The state has changed the renewal dates for a lot of clients. So if you want to find out when your client has a Medicaid renewal date, there's several things that you could do. You can call the Cover Virginia call center at 1-855-242-8282. And for hearing impaired people, it's 1-888-221-1590. If your recipient is a Fairfax County resident, you can reach Fairfax DFS at 703-324-7500. In the event that your individual is in another Virginia locality, the link in the PowerPoint presentation is a link to the state site to look up the phone numbers and addresses to the local social services departments that that individual may be in. And that email address is https://www.dss.virginia.gov/local-agency/index.cgi. It's important if you're calling the Cover Virginia call center, you get the main menu, select option 7 to be navigated to the assister menu. And from there, there's submenu choices. From 7, you'll have options for applying for Medicaid, checking the status of a pending application, existing coverage inquiries, and renewal-related questions. In the event that if you call the 800 number and do not get a satisfactory response to your inquiry, there also is a state email address at auth_rep_inquiry@covervirginia.org. LTSS Medicaid Renewal Process. The state attempts to run an ex parte renewal on all cases. Cases that have resource tests fall out of the ex parte process and require manual renewals. Cases that have a resource test must complete a renewal packet that is mailed to their address. Or they can file online through Common Help or call the Cover Virginia Center, Cover Virginia Call Center. What does that renewal packet look like? The packets that are received are rather bulky. It's a big envelope that the client gets with the renewal packet in there. The renewals itself are about 20 pages long, possibly. Some are even longer, depending on how many people are on in the household. But the Virginia Department of Social Services mails the paper renewals 60 days before it's actually due. Upon receipt, the client or authorized representative has 3 different ways to start the Medicaid renewal process. The first way is to review the forms that are sent to you in the mail and sign the renewal in the appropriate spots on the forms. The other way is to log into Common Help and to fill out the renewal online. The third way is to call the Cover Virginia call center at the numbers listed here and file the online renewal that way. Preparing for the Medicaid renewal, renewals that are filed through Common Help or the Virginia call center are issued a T number confirming that their application was filed online. It's important to keep that information that T number available, because in the event there's a problem, you want to know what your T number is to give it to us so we can try to find what happened to that application. Cases that do not meet the ex parte renewal process are processed at the local agency. Once the local agency receives notification that the renewal packet has been filed, the worker must send the recipient a checklist of verifications. This is a system-generated form that gives the client 10 days to provide the missing verifications for us to determine eligibility. Here are some key dates in the Medicaid renewal process. 60 days before the renewal is due, VDSS initiates the renewal process. Recipients' authorized representatives have 30 days to return the packets or file online through Common Help or use the Virginia call center to file their renewal. Once the renewal worker has received the application, a checklist of verifications is generated. Recipients' authorized representatives have 10 days to return the verifications. Medicaid deadline is the 16th of the month unless the deadline falls on the weekend or a holiday, then it's usually the Friday before cutoff. If no renewal is returned by the 16th of the month, the case can close on the last day of the month. And our long-term care services and supports, nursing facilities, and the CCC Plus waiver providers are also notified if we're about to close a case. What happens if a LTSS Medicaid case closes? Cases that close on the last day of the renewal month for no review or failure to provide verifications have a 90-day grace period to file the renewal. Recipients will not have access to their managed care plans when their case closes. If the case is reinstated in that 90-day grace period, it can take up to 2 to 3 months for the MCO coverage to be reinstated. Recipients need to inform all their providers in that time to use their Medicaid fee-for-service card. If you're not quite sure what your cards look like, on the right-hand side of the screen here, we have a copy of 2 different cards. The card on the left is the old Medicaid card, and on the right, we have the new cards that are being issued for clients that have started Medicaid in the last year. Medicaid program has shifted to a new name. It's now being called Cardinal Care. So that's what the new cards are looking like at the present time. If the case closes and the recipient does not file their renewal during that 90-day grace period, the client has to file a brand new application and start the process over like they're a brand new recipient. How to assist in the renewal process. It's important to start gathering your verifications as soon as you receive your packets. Some resources, such as life insurance, can take time to receive. Also, if recipients have a trust or established one since their case was last reviewed or established, we need copies of the entire document, as we have to send those off to the state to be reviewed. And then we also do require verification of the disbursements from the trust. Once the trusts are read by the state, they tell us what we need to do with the trusts and evaluate for resources and transfers that may have resulted from the trust, because sometimes that can affect a person's eligibility for Medicaid. If the recipient has income sources other than Social Security, gross income verification is required from the source. So if you have like a federal civil service pension, or just a pension from a job other than Social Security type things, you do have to provide that current verification, because we do need to verify actual income when it comes to the long-term care population, because we're determining patient pay for each individual. We do have access to Social Security records, so that's why we're not requiring verification of that information. The LTSS Medicaid processing resource requirements. If the situation was for an individual at intake, the resource limit for single widow individuals is $2,000. Married couples is always based on the resource assessment. There is no change on the application side of things. At renewals, though, because of the unwinding, this part is not changed. The resource limit has always been $2,000 for individuals, for all long-term care individuals, regardless of their marital status. But this is where things start to change a little bit. The $3,200 COVID relief payment will be assumed to have been received by all individuals with a resource test and will be excluded. But there's a 12-month exclusion policy may apply. Only applicable to excess resources due to the accumulation of patient pay. The amount that was the result of the accumulated patient pay can be excluded. So for example, if a recipient has accumulated patient pay of $500 a month for a certain a medical expense deduction that may have happened, and it's still continuing. What we do is take the $500, multiply that by the number of months of accumulation is the excluded amount. Other assets retained other assets that retained that result in recipients being over resources are not subjected to a 12-month exclusion. Example is a recipient sold home and the proceeds from the sale were placed into recipient's financial account. No action was taken due to continuous coverage. No subject to the 12-month exclusion applies. So there's two different things that we're looking at there. The main thing is with recipients, if they did sell their home, it's not that they don't get this 1-year exclusion for eligibility. If they sold their home, they still maintain those resources. We will be closing those cases out for being over resources, and they can privately pay for their care until they're re-eligible and reapply at the point of when they're eligible again. The LTSS renewal processing for patient pay. During the period of continuous coverage, we were prohibited from taking any negative action, including reducing and closing coverage and increasing patient pay. If a client's patient pay was reduced, it could not be increased for any reason. The personal needs allowance for CCC plus waivers currently is $15.09 per month, and nursing facility residents, it's $40 per month. LTSS Medicaid processing for asset transfers. Individuals who are eligible for Medicaid may not be eligible for Medicaid payment of long-term care services for a specific period of time. That's a penalty period if they or their spouse have transferred assets or for less than market value without receiving adequate compensation. At renewals, we're only looking at the individual, though, that needs the long-term care. All LTSS cases must be evaluated for asset transfers except for accumulated or retained assets that no longer remain in the client's possession. So pretty much if what the client provided at intake, if they don't provide that resource verification, we will be requesting that to follow up on what happened to that resource. The LTSS Medicaid renewal processing. We're looking at current information at renewal regarding income and resources to determine eligibility prospectively. During this continuous period requirement, clients maintain enrollment in LTSS even if they were not receiving services. Beginning April 1, 2023, this allowance will be discontinued. Clients who do not receive services for more than 30 days may lose their coverage. If a client loses LTSS coverage, we will evaluate eligibility for other covered groups to which the customer may be entitled to. And here is a question: why is my CCC plus waiver coverage changing? CCC plus recipients' gross monthly income limit is $2,742 per month in 2023. Ongoing eligibility does not exist when the renewal is completed because the PHE is ended. Recipients are placed on a monthly medical spend down. A spend down is like having to meet a health insurance deductible on a monthly basis. Eligibility is determined every month retrospectively. The recipient will not have ongoing coverage. Patient pay is determined after eligibility is established. And on the right-hand side of the screen, I have an example here for you. Ms. Smith has $3,000 of gross income per month. She's on CCC plus waiver. Her renewal was approved. However, she no longer has open coverage because the PHE is over. Ms. Smith's notice of action states that she must meet a monthly Medicaid spend down of $2,398.96 per month. Ms. Smith needs to, in October, gather all medical expenses showing that she met the Medicaid spend down for September. The medical bills need to exceed $2,398.96 to be eligible for that month. The eligibility worker processes September eligibility in the month of October. issues patient pay for September and enrolls the client in the Medicaid system for the month of September only. I'm sorry, it's only for the month of September. Ms. Smith is sent the notice of action informing her of all this, and this process is going to continue indefinitely until Ms. Smith either enters a nursing facility or chooses another type of LTSS placement, such as PACE, if she resides in a PACE service area. That's another form of Medicaid coverage for long-term care, and eligibility is determined differently for that type of program, where you may not have to do the month-to-month spend downs for them. And what happens if I don't agree with the outcome of the renewal? All recipients receive a notice of action informing them of the decision. Midway in that paperwork, you will find additional information about appealing the decision. On the right-hand side of the screen is what it looks like for information about appealing your decisions. How to submit documents to Fairfax County. All 4 of our offices are open for business, but we're still continuing to encourage skip the trip service. Skip the trip and use services online whenever possible. The link here, https://www.fairfaxcounty.gov/family services/employment-services is a link to the 4 different offices that we have. In addition to the 4 different offices that we have, we also have DFS My Case at fairfaxcounty.gov as a way to email your verifications and correspondence to. Please make sure, though, if you are submitting documents in any of these methods, that you put the client's name on it and the case number, so we get the documents to the correct corresponding case. The fax number that you can send verifications to also is 703-653-6679, or you can mail it to us at 12011 Government Center Parkway, Suite 232, Fairfax, Virginia, 22035. In addition to the ways to get it to us at the local level, you can certainly go online to Common Help and upload your documents there. That's https://commonhelp.virginia.gov. The 800 number here is just for applying through the call center if you want to apply for Medicaid, SNAP, TANF, and other assistance programs. You can call the Enterprise Call Center at 1-855-635-4370. Other helpful phone numbers in Fairfax County that you may have want to have for your long-term care client. The Fairfax County Ombudsman Office, that phone number is 703-324-5861. They provide assistance with if you're having like provider issues or nursing facility issues. There's staff there that can help you answer those type of questions. Fairfax County VICAP program is 703-324-5484. They comprise they're a group of individuals that assist with health insurance questions, primarily with Medicare issues that you may have, and they can assist with those type of issues that you might be having as far as Medicare goes. Also, there's Fairfax County Adult Intake, and that phone number is 703-324-7948. What they do is they're the overall information to all of Fairfax County for social workers for adult cases. And also, at times we are running into some issues with long-term care screenings if a case closes. If there's a problem and the agency is saying that screenings are needed, they may also be able to be of assistance in figuring out what is wrong with the screening that the agency already has on file or what's needed to proceed. Key people when it comes to long-term services and support team. Janetta Vinson is our program manager. Myself, I'm the LTSS intake supervisor. Aaron McDonald and Danielle Heller, both of them are supervisors for our ongoing case management teams. We have 2 teams because of the number of clients that we have. And Amanda Williams is a supervisor for the LTSS transfer over unit supervisor. Her unit handles clients that already have some form of Medicaid coverage and need to get it open for long-term care services and supports. That brings me to the end of my presentation. I don't know if anybody has any questions out there.
Yes, so again, thank you so much, Joan, for this insightful presentation and for sharing your expertise with us. This was really informative. And at this point, I would like to invite our audience to submit any questions that they have. The Q&A box is at the bottom of your screen. If you have any questions, please submit them there. And while we're waiting for any questions to come through, I do have a question here for you, Joan. Can someone obtain coverage for a medical emergency even if they are not eligible for full Medicaid?
Is the person asking about emergency services for aliens?
It just says, can someone obtain coverage for a medical emergency even if they are not eligible for full Medicaid?
I believe, well, they must be talking about or inquiring about clients that are aliens and or the undocumented aliens that want emergency services for Medicaid. And that program is only provides assistance for a hospital emergency. The emergency services component changed a while back where they're kind of like getting open coverage for ongoing, but it doesn't cover long-term care services and supports.
Okay. Another question that we have is, are people able to have both Medicare and Medicaid?
Yes, they can have both Medicare and Medicaid. That's what because their Medicare continues, and Medicare is always their primary insurance, and it's billed first, and then Medicaid is the secondary insurance. It's always the payer of last resource.
Okay, and would you be able to elaborate on like a little bit of the difference of what each one pays? Do they pay for the same kind of coverage, Medicaid and Medicare?
Usually Medicare only covers approximately 80% of a claim. That's where sometimes individuals need either like a supplemental like health insurance plan, or they need Medicaid because Medicaid picks up where Medicare leaves off.
Okay, great, thank you. And then what do clients do if they are not able to get a hold of their actual caseworker? What would you suggest for like if a client has called and they just haven't been able to, or they've been playing, you know, tag
Phone
and
tag.
get a hold of
They
them?
can reach out to one of the supervisors for the worker. If they're not quite sure who the supervisor is, they can call the DFS call center. It's 324-7500 to find out who that supervisor is too.
Okay, great. And then I do see we have a question that's come in that's asking, it says, will telephone be used for review? Personal received call, like a personal call for reviews? And I'm not sure if they mean renewals.
If they want to file a renewal through the Virginia call center, they have to go through that 800 telephone number that's in the presentation. because that's the only phone number that they're allowed to use to file that renewal via the phone.
Okay,
Otherwise, the packet that they've received in the mail, they should use and sign and send that back. Or they can go onto Common Help if they have ever logged into there and filed the renewal there too. Those are the 3 different ways.
okay.
But they can't call the worker directly to file a renewal. We
Okay,
don't have that capability at this level. That's at the state level.
okay. And then we've seen the Medicaid packet. You mentioned that it was, I think you said 20 pages or something similar to that.
Approximately, yeah.
Yeah. Is there a way for clients to get assistance with the either an application in person, like if they receive an application, have a hard copy or need assistance with the renewal? How can a client, if they can't understand the document, how can they get assistance with the application or with the renewal?
Well, if they call the DFS call center, they should be able to help them on the phone with the renewal paperwork, that type of thing. If somebody were to come into any of the offices, our workers are only in the Fairfax office, but I don't, because everybody's schedule is so different now, that they may not actually get to see the actual worker. It may just be someone else that would be filling in just to help them answer the questions to get them to sign the form and leave it for us.
Okay, and if they do call the call center, is there interpretation or interpreter services that are available?
We can get interpreter services on the phone if the client needs that and requests it.
Okay. And then you did mention that there was a change to the name. I know it used to be CCC Plus, but you mentioned that name has changed. When did that take place?
Last July was when they were starting the change of the name for Virginia Medicaid. So it's now called Cardinal Care for Virginia Medicaid. So a lot of the correspondence that's coming out of the state will mention Cardinal Care.
Okay.
So they haven't exactly broadcasted it everywhere from what I know, but
Okay, so would you say that most so the cards have changed, so most clients should be
cards,
receiving?
well, if you have had Medicaid in the last year approved, you're getting the new card. If you've had Medicaid for quite some time, your old blue card is still working.
Okay,
That's what they've told us for now, and they weren't planning to reissue those. But if they've lost their Medicaid card, they can certainly call either the local office, or they can even call that Cover Virginia call center, and a new card will be issued. Most likely, it'll be reissued with the new logos on it.
okay. And I wanted to reiterate to the audience today that the PowerPoint presentation has been sent out. I believe it went out this morning in an email. The recording of this webinar will be sent out in about a week. Today, when we sent out the presentation, we also sent out a few handouts to help with folks who may not be, because of the public health emergency ending, may no longer be qualified for Medicaid. So please look at your email and see if you have those items, and let us know if you did not receive them. But I believe those went out this morning. And again, this presentation will be sent to all registrants in about a week. So the attendee who mentioned about will telephone be used for the renewal or review? Joan says, no, I received a call. She's saying that she received a call I don't, are the workers calling regarding renewals, or is there a reason that the,
Well, if we didn't get something, they are making contact with clients saying that we didn't receive the renewal to let them know.
Hmm,
So I don't know if that was the call that she's referencing to. If she wants to reach out to me directly afterwards, and give me the case number and stuff, I can look more into the
okay,
case.
okay. And then, let's see here. Let's see, so would you say that some of the issues for folks not qualifying for Medicaid right now is not receiving documentation back? Is that what I'm kind of hearing, or
That's
verifications?
It's part is we haven't received the packets at all. Another part is we've got packets back and they're not responding to the verification requests that we've sent out. Um, and then some may not be eligible for other types of reasons, because like if they did sell property during the PHE, and now they're over resources, we can't keep that type of case open anymore.
Okay. And then not sure can you tell me what MES is? MES?
MES, that's, I believe, the eligibility system
Okay.
that
I have
with
a,
DMAS.
okay. So an attendee states that the renewal dates calculated from the case review dates on MES have not matched several of our clients' actual Medicaid renewal. We were told that the county works off of a state
The
law
state,
for the
yeah,
renewal dates. Why doesn't the MES match? I have no
well,
idea what that means. That's a Medicaid thing, I think.
yeah, the state issued a renewal schedule to us, and we're required to go by that state schedule, and dates are not matching at all. That's why if you want to find out when that packet is being mailed out approximately, it's best to give that number at the state a call, or you can call our main number 324-7500, and they can look it up, what the approximate month for the renewal date is.
Okay. And then you did mention ex parte process several times. There's a question asking, what does ex parte process mean? And how do we know that it's happened?
The ex parte process is where the state tries to automatically redetermine eligibility for all clients. What happens though is when they do the first run, around like the 20th of the month approximately for 60 days out. Um, and when they run the case, they are trying to see if they can verify everything electronically. There are very few things that we as eligibility workers have access to. We do now have what's called asset verification systems, where resource bank accounts are electronically verified, but not all banks participate with AVS. So we run into problems where sometimes we don't have enough information to run the AVS system, or it comes back that it's pending a response, and we sometimes get information back, sometimes we don't. So that's why we're sometimes at that point when there's a resource test that we have to do, we have to send out the checklist as far as what's needed to process that case. So, and we only really need the current information. We're not asking you to provide up to 5 years of information, unless there's some really weird situation that you're trying to verify, but we're just looking for the most recent information to redetermine if you're eligible.
Okay, thank you for that. And then again, when should we expect the renewal package is a question. Will all current participants require renewal every year moving forward?
Yes, everybody, we're back to the old rules. Everybody has a renewal every single year. Some some recipients that we've had like on Medicaid coverage for more than 5 years, they have already, they remember the process of what it was 5 years ago. And then it was a shock when all of a sudden we told them we're not, you don't have to, we're not doing a renewal now. And we didn't do them for 3 years basically. So
Mhm.
now we're trying to get caught up on basically 3 years of work basically. So but the renewal, if you remember if you had Medicaid 5 years ago and we're doing a renewal, your renewal date may not be the same date anymore. That's why you may want to call the either Cover Virginia to find out when you're going to have your renewal, or our local office at the 324-7500 number, and they can look into that information for you.
Okay, thank you. And then going back to that ex parte question, how would one know that the ex parte process was successful?
Well, they would get a notice of action from the state. It wouldn't come from the local office at all because this is all done electronically. A lot of our SSI clients are falling into that group of where it can be done ex parte. And also some of our MAGI adult individuals fall into that too.
Mhm.
But anybody else that has a resource test will unfortunately have a renewal packet that they're going to need to complete and actually get verifications to us.
Okay. And let's see, I know we have been focusing on the long-term care Medicaid, the LTSS, but
Mhm.
I know that there is oftentimes some confusion, or clients don't always know like the different types of Medicaid, that there's different types. Would you be able to, because we do have a little bit more time here, would you be able to kind of go over the different types of Medicaid? Is that something that you could briefly review?
I can try briefly here. Medicaid has like two different realms. There's family child Medicaid, which is a little more complicated in some situations. But for adults, there's also regular Medicaid, ABD Medicaid, which has a different income limit. The Medicaid program has all different income limits to it. And individuals that are within income limit of $972 for a single person, they can get ABD Medicaid, ABD 80% Medicaid. If they're a two-person household, that's $1,325 for the full coverage Medicaid as an adult. There are what we call the Medicaid Spending MSP programs, which are QMB, SLMB, and QI coverage. Those are limited covered groups for Medicaid. Each program has a different income level for eligibility, and resources are looked at differently. For ABD 80%, it's the same $2,000 resources for a single individual, or $3,000 for a married couple. But when you're getting into the MSP programs of QMB, SLMB, and QI1 individuals, their income, their resource limits are different from regular Medicaid, because they can have a higher resource limit. QMB individuals basically picks up where Medicare leaves off. So that's like a supplemental insurance policy for those individuals that qualify. The income limit for a single person is $1,235, and a married couple household of two is $1,644 for QMB. And then SLMB, that pretty much covers just the Medicare premiums that an individual has. And that income limit for a single person is $1,458 and $1,972. And the QI1 coverage, that's income limit is $1641 for one person and $2219 for second person. And that program pretty much only covers Medicare premiums if money is available at the state either at the end of the year. I'm not quite sure when they send that type of money out to those individuals. But in the QMB, SLMB, and QI1 coverage groups, you can have spend downs if your resources are below $2,000 that you can meet. The other thing is for your adults Medicaid in general, there are spend downs that they can meet if they're over income, if they don't pass screenings for long-term care services. For married couples, the resource limit is $3,000. Single people, it's $2,000. And you have a 6-month spend down of medical expenses that you would need to verify in order to see if we can open you up for full coverage at that point. When you meet a spend down though, you have to provide verification of all the medical bills that you're paying, that you of what you're actually left responsible to pay out of pocket.
Oh.
So because we have to see that all the other insurances that a client has paid for that service before we can apply it towards meeting your spend down. So Medicare would need to be billed if the person's over 65, or if they're disabled and have Medicare, they would need that. If they're and then if they have a supplemental health insurance, like a Blue Cross Blue Shield, AARP plan, anything to that, we would have to see that Medicare billed, AARP billed, and then what's left over on that bill. And then we would apply it towards the spend down. There's that other covered group of MAGI adults, but those are only for individuals that are between the ages of 19 and 64 years old. If they have Medicare, they're not eligible for MAGI adult. The only program that they would possibly be eligible for then is to qualify as ABD Medicaid.
And what does ABD stand for?
Age, blind, and disabled.
Okay.
And the MAGI adult income limit for one person is $1,215. And then for a married couple household is $1,644.
Okay. Well, that's a lot of information. What would be the best way to, like, if someone, needed health coverage, wasn't able to understand any of, what you just explained, what's the best route? Just to say, I know I need something, and where can I go for someone to determine where I fit based on my income? Because you're saying that it's depends on your income.
Income, resources, depending on the Medicaid program that you're qualifying for. They could always start by calling the main line for DFS at 324-7500, the call center there, and explain what's going on. When it comes to your long-term care population, we have to get them screened first if they live in the community. If they're already in a nursing home, then that's a different situation and don't necessarily need to get them screened. But if they are living in the community, they must be screened first to see if they meet the medical criteria for long-term care services and support. If they don't pass that screening and they still want to apply for Medicaid, they certainly can, but they may not be eligible with higher income brackets that we have in the long-term care realm of things,
Yes.
because the income limits are a lot lower for regular Medicaid, depending on that person's situation.
Okay, great. Okay, well, thank you so much for all of the information. I think the main thing for our caregivers is we want you to reach out, if you need help understanding and kind of getting a grasp on long-term care Medicaid or any of the other Medicaids that Joan mentioned, please reach out to the main number. Can you give that number one more time, Joan?
703-324-7500.
And then our main adult and aging intake line is 703-324-7948. So again, thank you very much. We are at the end of this program, and what an honor it has been for you to present. This presentation has been very informative and helpful to those who are struggling to understand Medicaid and the Medicaid process now that the public health emergency has ended. To our audience, I want to thank you so much for making time on your busy day to be with us. We appreciate you and your commitment to learning and growing. As you sign out, there will be a brief survey. Please take a moment to answer those questions and let us know what you thought of today's presentation. This helps us to provide topics that you are interested in. Let's see here. Our next webinar is going to be on September 20th at noon, which is a Wednesday, September 20th at noon, on the best practices when you are chosen to manage someone else's money. Tom West, Senior Partner at Signature Estate and Investment Advisors with SEIA, will provide caregivers with information about managing someone else's assets. The presentation will focus on fiduciary roles for durable power of attorneys, trustees for a revocable living trust, veteran affairs fiduciaries, representative payees, guardianship, and conservators. Join us to learn what caregivers need to know when accepting fiduciary responsibility for someone else's money and property. Thank you again for joining us, and I hope you have a wonderful day.